Hi, I'm Bianca Castro with NBC5 Health Connection. We'd like to share with you some of our recent stories that feature your Medical City healthcare doctors, staff, and patients. A former Plano City Council member and current Medical City healthcare executive has made an incredible recovery from a rare form of West Nile virus. 38-year-old Ben Harris became paralyzed and nearly died after contracting the disease from a mosquito bite late last year. Harris was hospitalized for 5 weeks in the intensive care unit at Medical City Plano, receiving life-saving treatment before moving to a rehab facility for 6 months. He had to learn to breathe, eat, and walk on his own again. He now lives without restrictions and is back at work. He's using his story as a warning and inspiration.
I was fully healthy, rarely went to the doctor, rarely used any sort of medical care, and it happened to me.
Harris says his case serves as a reminder to put on mosquito repellent every time you go out. Well, doctors have long recommended that people who have already had a heart attack or stroke take a low-dose aspirin every day to prevent another one. Well, now major research has tested whether aspirin can also prevent first-time heart problems. One study looked at patients at moderate risk of a heart problem because of health issues like high blood pressure, high cholesterol, or smoking. Results showed no benefit from aspirin. A separate study tested aspirin in people with diabetes who are at greater risk for heart problems, and it found that the good that aspirin did was outweighed by a greater risk of serious bleeding. Dr. Dale Yu, a Medical City McKinney cardiologist, told us the findings might spark conversations between patients and their doctors. He says the main piece of advice doesn't change. Aspirin does most good for people who already have heart disease. We hope you enjoy the Medical City Healthcare headlines, and thank you for watching NBC5 Health Connection weekdays at 5 p.m.
NBC5 Health Connection is brought to you by Medical City Healthcare.